Professor Ameenah Gurib-Fakim is the former president of Mauritius. She's also a biodiversity scientist. She holds Laureate awards with the African Union and also with UNESCO, amongst many others. And today she's going to be talking about questions concerning why we need to invest in our institutions, and particularly looking at why there is no planet B, and that may touch on other aspects such as tourism as well, in terms of the perspective coming from Mauritius. Then Adjunct Professor Borja Santos Porras, Executive Director of IE School of Global and Public Affairs. He has led international programs in Asia, Africa, and Latin America, advising governments through humanitarian concerns. And he's going to be talking today about questions related to the impact of COVID-19, in particular with a focus on the economic implications and how international financial institutions will play a role in that regard. So finally, we can very much look forward to the final panelist. Dr. Velislava Petrova is a research fellow with UNAIDS and a consultant at CEPI, the Coalition for Epidemic Preparedness and Innovation. And she's going to be talking through some of the concerns in regards to innovation and financing models, and also in particular community engagements, which really speaks to what Cov360 are about in terms of building a community for us to work together through this crisis and have a positive future ahead. Now, if I may, first thank you, Ameenah, for joining us. And I was overwhelmed when you positively responded to my message over LinkedIn, and it's been wonderful to interact with you. I will hand it over to you to talk. Thank you very much.
Thank you very much, Theo, for putting this together. And as you have rightly pointed out, we have an amazing panel discussion today, touching on key issues. So if you'll excuse me, now and again, I will pull the kind of the carpet under what I would increasingly refer to my home continent, which is Africa. So I will try and make the point for the African continent. But having said this, whatever I will say, I think it resonates with other parts of the world where we are increasingly referring to the importance of institutions. Now, as you know, on the continent of Africa, and also this also applies to my country, Mauritius, most countries in Africa, we have just over 50 years of post-independence history. And, you know, during the colonial setup, all institutions were producing, graduates, producing civil servants, precisely to man the country, which of course was under the colonial power. So they were generating more and more civil servants, right? Trained in the social studies, public administration. So all these were actually, they were the output of universities to provide for a setup which was already there. So when the colonial powers left many of our countries, in fact, most of the African continent, we find that this model of university, for example, has remained the same. And the mindset in many countries is that education, health, social security net, all these are the problems which are for other people to look after. Right? It doesn't have to come from within. So this mindset has perpetuated, and Africa has had a very violent history as well, in as much as governments were changing through coups and through wars, and we've had all that. Now that things are moving on, now that countries are becoming, countries are now training the people more, we're finding a mass of young people of a certain age who are educated, who are looking at things from a different prism. And then just to put again on the side some of the economic indicators for Africa, We have the youngest continent. We have the age bracket will be between 16 to 18. Technology is very much present. Africa has 60% of the arable land in the world. Africa is the blue continent. Africa has got tremendous amount of resources, and Africa has got even the Sahara from where we can generate renewable energy, if anything else. So to me, all the indicators are there, but Africa is also a continent which is going to be increasingly urbanized. So by 2050, 70% of the population of the African continent will be living in cities. So that's another thing that we'll have to grapple with eventually, because we'll touch on, for example, climate change and how all these will impact the continent and of course elsewhere as well. So we come back now to institution building on the continent. So universities have not, in fact, many universities in Africa, they don't appear in the 500 listed universities in the world. They're very, very few. And many of them you'll find, of course, in South Africa or in some other places across the continent. So we have a big task ahead of us to actually consolidate and in some cases literally build the institution so that we can have reference centers from where data can be generated. And I insist on data because we are seeing right now the lack of data means that we can't shape the policy with the appropriate data which is coming from the ground. So building institutions to generate this data so we can shape policy, which of course are relevant to speak to our reality on the continent there. Now, this is of course for in terms of the academic side, in terms of the education side. Now, what about the health sector? The health sector has also been the orphan child on the continent. We haven't really invested in the health system. And when I talk about health system, I'm not talking about the sophisticated high-end side of the health system. I'm talking about public health. General, basic public health, which has to be deployed across the continent, if anything else, to counteract COVID as we speak. Because if you look at what the WHO, for example, is formulating, it is saying that just by washing your hands and wearing a mask, you could stem back a lot of the infections. Now, so the health system is a challenge. It is not being kind of capitalized as it should be. And if we don't build on it, if we don't actually invest in it, we'll find ourselves, of course, at the mercy of all sorts of pandemics. Unfortunately, with climate change, of course, it's the next issue we'll have to grapple with once we have finished with COVID, is we shall see that there will be more pandemics to come through. The third point I would like to bring on board, and also it concerns institutions, is how do we provide for the social safety net to our people? Because people who are sick, who don't go to work, do they get compensated by the state? Kids who have lost their parents, does the state help them in providing some form of allowance per month so that that kid can grow up? I mean, all these things have to be brought on board. And again, when I talk about education, when I talk about health, when I talk about social safety net, to me, these are not expenses. To me, these are investment. It is investment in the people. Just to give you an idea, in terms of provision of social safety net, those countries that have good social safety net, these are precisely those countries where people tend to be more innovative. People can take leave of absence. People can change jobs because they know there is a state there that is going to provide for these people who don't have a job, for example. And yet we find some of the richest countries in the world, they provide threadbare social safety net, which means that sometimes people get stuck in the same job because they don't want to lose, for example, the health insurance. So these are things that we have to put in place in our countries so that we can cope with pandemics as and when they arise, and we will provide them with the necessary tools, if anything else, in terms of preparedness and in terms of course, provision for food, for access to basic healthcare, and to all the other issues that, of course, we shall be talking about later on in the conversation. Thank you.
Thank you so much. That was highly informative and drew us through the history as well as bringing us to that present and the future and what those needs are. So thank you so much, Ameenah, for that talk and discussion. And now I'd love to hand it over to Professor Borja Santos to discuss briefly on your presentation, looking into the economic implications of what's happening. Borja, over to you.
Thank you, Theo, for organizing this panel and this talk. I lived 5 years in Ethiopia, and the current Prime Minister of Ethiopia, Abiy Ahmed, published a very interesting article a few weeks ago where he was saying only a global victory can end this pandemic. And he was referring about the future assistance that many African countries would need if we want to beat COVID-19 at global levels, right? But someone might say, well, but why Africa if we see that the numbers are relatively low, right? That countries with a high number of cases are maybe South Africa, Morocco, Egypt are around 5,000 cases. So why as well the General Director of the World Health Organization, Tedros Ghebreyesus, is highlighting the importance of supporting and investing in Africa. So I'm going to explain in my presentation why there is a high risk on the healthcare, on a potential healthcare impact, and the current already impact that the pandemic is having on poverty and on food malnutrition, and what are the drivers for those impacts. So in terms of healthcare impact, I mean, even though the numbers are not very high, we need to as well to consider that there is a limited availability of tests and the capacity to count, right? But if the pandemic would increase, I mean, I was reading different newspapers from different African countries, and for example, in Sudan, having a population of 44 million, in the newspaper were saying that there was no more than 80 ventilators, right? Consider that New York, for example, with 10 million inhabitants, when the crisis started, they had 3,500 ventilators. So almost like 50 times more. So the same thing you could argue with care beds, with health material, because of the impossibility to import, the prices have increased. The lack of protective equipment for health workers, the number of kids, the number of doctors. Just for example, in Spain, we have 20 times more doctors than many low-income countries. And even though, look how we are, right? So the impact on the healthcare system can be huge in the near future. So then, why this is translated in an economic impact? So basically, I mean, the longer the confinement will take in order to protect the lives and the healthcare system of many countries, for example, or many low-income countries, the higher will be the economic impact. And when we are talking about the consequences of this socioeconomic impact, what we are talking about? So I mean, in terms of poverty, the World Bank just published some projections recently, and they were suggesting that already the COVID-19 is pushing between 40 and 60 million people into extreme poverty. So that would, half of those numbers would be in Sub-Saharan Africa, but also in South Asia, because countries that will be more affected would be India, Nigeria, or Congo, for example, right? And this is only considering extreme poverty that is based on $1.9 per day. If you consider other poverty lines, like from low, medium income countries or medium income countries that are in 3.2 or $5.5 per day, the numbers are increased to 100 million people that will be pushed to poverty. And the same thing when we talk about food insecurity. World Food Programme and other organizations that work on food insecurity added that 130 million will be pushed into acute risk of food insecurity. So what are the drivers? So, I mean, if we consider the macroeconomic drivers, I mean, as well, we could say that even though the IMF have projected to contract by 3% the economy in 2020, and when you analyze and differentiate high advanced economies and low-income economies, in advanced economies, they project 6% of decrease, and in low or in developing economies, only 1%, and you would say, so why suddenly there is so much impact in poverty? So one of the factors is remittances. Remittances are very important for many low-income countries, and even, for example, since 2019, remittances flows to low and middle-income countries became larger than foreign direct investment, for example. It's super important, and remittances are going to decline at least by 20%. Why? Because many, for example, migrant workers in the US and in other countries will lose their jobs and they will fall in the wages and in their employments. So they are more vulnerable to decrease their income and therefore to send remittances. And interestingly, remittances have been usually counter-cyclical. That means that, for example, if there is a drought or a hunger crisis in the Horn of Africa, right, then families, imagine Somali diaspora that are in other countries, they are helping much more. But in this case, it's the opposite. They cannot, even though there might be a crisis there, because they are following their income, they cannot help. So this is something unique, this fall in remittances that didn't happen in previous crises. Then we have the commodity falls that will affect especially many low-income countries where the diversity is really low, and countries that depend a lot on commodities, that is the case of many, will be affected, right? Think countries like Ecuador, for example, that like more than 30% of the GDP depends on oil, so the impact is getting huge. But also in many other countries in Africa, and in commodity fall, we also could include as well tourism, and Ameenah was saying, right, because of this lack of movements, lack of imports and exports, because probably when we will have this reopening phase, transportation costs might be higher, so that might also increase in higher trade costs, higher prices in food. So that is going to affect as well. The third one, apart from remittances and the commodity fall, will be definitely the debt, right? This external deficit. So the more you lock down your country, the more fiscal space you will require in the future, right? To mitigate the recession that will result, right? And we are experiencing that, especially in European countries like Spain. However, since 2008, since the global financial crisis, the debt has, because of the low interest rate, the debt has increasing hugely in many different countries. So we are in a context where the debt is also very high, and all of the countries are in the similar position. So there are many different recipes, traditional recipes, that might not be able to apply, and the risk of a crisis after this period is very high, right? So the financial support, and we will speak later about that, will be very important to give the opportunity to these low-income countries to have some fiscal space, because it will be very tough because of the high debt, because of the lockdown as well of the markets where they can get access to the money, etc. Another fourth one at macroeconomic, and the last one, will be the capital flows. So based on the International Finance Institute, the investors have retired 80,000 millions from emerging markets during the first quarter of 2020. So, suddenly, so there is a huge retirement of capital flows from this country, and you joined us with a sudden stop of the debt market. So this is going to affect highly as well the finance institutions, right? And how important they will be, as Ameenah was referring. And then we have the microeconomic impact, right? So as we know, many people, low-income workers, have more chances to lose their jobs. There is high levels of informality, and high levels of informality, for example, in South America, in average is 55%, in Sub-Saharan Africa is 65%. That means that there is a lack of safety nets and lack of insurance. And as well, these people are harder to reach and support because are not included, right, in the formal figures and numbers. The second is, many individuals in these low-income markets and low-income economies are having small and medium-sized firms, right? Those what are going to have a lack of access of capital and liquidity problems like we are experiencing now in Spain and many other countries. I'm from Spain. Then, and imagine in urban areas, I was referring about the huge urbanization of many capital cities in Africa, where they live in congested settlements, right, with low quality services. So is going to have an impact as well. Then, there are services like health and education that depend a lot on the public services, on the institutions as well. So if there is a limited access, even by movement, by economical and financial opportunities to those public services and those health and education, right, is gonna impact. Imagine in education, where there is no enough digitalization, there is no enough connectivity to have online or virtual education as we are having in other advanced economies. So, well, the impact on the investment on human capital and considering the young population of Africa is gonna have a huge impact as well. Well, the lack of insurances and for people who are kind of in that kind of poverty trap might push them to have coping strategies where they need to sell productive assets, or they cannot invest in human capital, in the education of their children, for example. And finally, the disruption in the food supply and markets, right? So probably as well, there will be potential shortage, hikes in the food prices, etc. So all these macroeconomic and microeconomic are going to have a terrible impact. So so far, when the lockdown will be reduced, and it's already affecting based on the data of the World Bank and the UN World Food Programme. And in terms of food insecurity, and I finish with this. So far, the main drivers of food insecurity were conflict, climate change, and economic crisis, right? And in total, more or less, acute malnutrition was considered that there was around 130 million. So the figure is doubling now. And it's doubling now because of some of the factors that we mentioned before, on micro and macro drivers, and well, you need to join us with conflicts that were in Syria and Yemen, with internal displaced people that because of conflicts that were happening in Burkina Faso, in South Sudan, the langosta plague that the Horn of Africa was suffering in the crops, economic crisis that they were in other areas. So that combination of these economic impacts and the problems that already were impacting food insecurity is what is pushing the numbers of acute food insecure people so high. So thank you. We can talk, Theo, later about the potential international development mechanisms that are applied.
That would be brilliant. Thank you very much, Borja. It's fascinating to hear. I think one of those aspects which you touched on that isn't often touched on is the remittances, that is the funds being sent out and sent back to Africa in that exchange. I think that's quite an interesting point to raise. It's also something you touched upon with commodities that interested me. One of the Cov360 trend reporters is your former student, Fazana, and she wrote about the economic implications in UAE. So this is an interesting drawing. But before I transferred over to Velislava, I mean, I'd love to come back on some of those points and picking up as well also on some of what Ameenah had said about those opportunities for development as well. So it'd be interesting to discuss those. Please, everybody, if you have questions in the audience, do put them in the chat. It would be wonderful in the Facebook chat, and we look forward to addressing them. But now, may I hand over to Dr. Velislava Petrova, and I did not and failed to mention that she's also a joint PhD fellow at the University of Cambridge and Wellcome Sanger Institute. So she's brilliant and a very apt researcher as a virologist. Velislava, may I hand over to you, please?
Sure, thank you. For me, as probably someone who has multiple hats, currently, it's interesting both as a virologist, as a person now involved more in the development sector, to see from both lenses, and the situation looks similar but different depending on the context, whether we are talking about global south or global north as well. The crisis presented a situation where we need to innovate, and innovation is a term that has as many definitions as many people you ask. But it seemed to me that we are facing the same problems that have been faced a long time before, and the results because of lessons that are not learned very well. I was reading an MIT technology review from the early 60s that were describing the future of humans, and the two main areas were considered as threats were food security and infectious diseases. And it was interesting to me that 60 years ago, this was seen as two areas of threats where we should have huge developments in order for us to be better prepared, and yet we still were not prepared as we should be. But this current situation has really put at test and exposed vulnerabilities, but also shown areas of improvement and future innovation that can change the way we address healthcare globally, and also the way we work together in solidarity and also in global cooperation. From a research standpoint, it's really a situation where in an unprecedented way, the research community has come together to provide information, to conduct research at a scale and speed that has probably never happened before. And largely it's been because of the enormous funding and also an enormous, public responsibility that the research community felt. And that probably is something that we can discuss later in terms of vaccine development and in terms of how are we using the core knowledge of basic research to transfer it to therapeutics and vaccine development. But if we broaden the conversation of what type of innovation do we really want to see, and we see it's needed, I would like to discuss in many levels, but mainly from the perspective of our work in Africa and in the global south more broadly. First, we see currently innovation repurposing in a way that we've probably not seen before. We see a lot of technology that we use for other diseases that are currently being repurposed. A lot of use of in a cross-sectoral manner from digital technology that are now being used for COVID that before we used for other diseases, and or were implemented in the global north and now can be tried and tested in the global south as well. There's this sort of push and momentum that COVID provides for innovators to find the exact context for their solutions. As someone who worked as a researcher and then went on to test mobile diagnostic labs in Sierra Leone, I realized very quickly that the way to implementation is not just coming up with the best technology, and very often the barriers are on political level, on really local capacity building, on regulatory and legislation level. So there's a lot of elements to the puzzle that need to be added. And now it seemed to really expose those inefficiencies in the system that require all the right stakeholders to come together in order to implement a new solution, even if it's the most innovative and promising one. And this is put to the test now, not despite the huge need to really come up with new solutions to provide better and cheaper ventilators or to provide really primary care services with innovative ways. We really see that the implementation is the biggest barrier, and that's where we need to innovate as well. On the other level, I really like to reflect on the point of Her Excellency about changing the way we fund health, or changing the way we provide aid to countries in the global south. Very often is considered first as an expense, and is also considered as a way of money with no return. And when this is a funding type of resources that are provided, very often the engagement, the local engagement, is probably overlooked in a way, and there is a very little effort put into the long-term kind of continuity and sustainability of any implemented solution and any capacity strengthening. And currently we really see a need for better capacity strengthening to make us better prepared for the future. This means not just better healthcare facilities, but also better education for healthcare workers. And we see innovation there, where there's blended medical models, blended educational models for education, for nurses and doctors that can be implemented. So strengthening both human resource, but also capacity. You can't incorporate and implement a new diagnostic solution that uses AI if 40% of hospitals don't have electricity, as with what we see with countries, very often in countries in Africa. So unless you take a cross-sectoral approach to healthcare and you invest rather than just provide funding in a donor model, we will come to the same problem of lack of preparedness over and over again. And that COVID just exposes it's a symptom rather than the cause of what we see now. And that's why innovation that comes beyond just new technologies, innovation in a cross-sectoral manner, innovation the way we fund, and really the stimulation of the communication. What we often see is a disconnect between private sector, public sector, innovators, implementers, and this disconnect has to be resolved if we are to provide solutions that are innovative but also that work and provide the impact that's needed. And that's where I see the future of how we innovate in terms of funding, really a lot more impact investment with clear definition of impact and clear engagement and country-specific ownership of any investment that's done. So it's not considered that healthcare or education are done by someone else externally, but really are owned by countries. But also having that idea that investment should come with economic opportunities that ultimately bring empowerment and better preparedness in the future, rather than just a response model. Every time there's an outbreak, we are also happy to mobilize resources to respond. But we, in the meantime, between epidemics, we forget again about how the global health means really global responsibility. And in that respect, as a virologist, I really see this virus as in a way reminding us that none of us is protected. If there's no vaccine, irrespective of your economic status, you are not protected. And in this case, it really puts at the front line this idea that we need to think of the economic inequalities that are underlying our preparedness globally and really try to address those in a sustainable manner. And that's where I see that hopefully the lessons that we learn now will lead us to a better preparedness in the future and ability to pull all the resources and relevant stakeholders together to address it. That's it.
Thank you very much, Velislava. It's highly informative, and I found very interesting in the sense of how you're tying together the network between the global and the local, and also in terms of how that science is communicated and going forward. One thing that struck me is they often say in times of war, technology proliferates, it speeds up. But it's interesting now that we are in quite a different scenario. We're in a pandemic and living through that. Maybe that technological innovation goes in a very different direction to where it would in a wartime period. But I'd like to bring it back around, and there's some very interesting points that, Ameenah, you may even want to pick up on and offer your insights. I was going to ask you, though, very quickly in terms of broadening the discussion a little bit and speaking to your expertise from a small island nation and how your country has been impacted and how other small island nations are impacted by supply chains and the critical measures that need to be put in place to ensure that those countries who are so import reliant are able to have the food insecurity, resolve the food insecurity that's been discussed already. If I may hand it over to you, Ameenah.
Yes, living on an island has got advantages, but also many disadvantages. And being a small country, we are totally reliant on import. And but now one thing as well is that the entire world now has become a supply chain. And this is something that I think has come has hit us very, very hard to realize that there is this interconnectedness, not just in terms of the supply chain, but in many other things as well. And I think this is something that we'll touch on when we talk about, the global aspect of how interconnected we are, be it in terms of biodiversity, in terms of diseases as well. So we as an island, we are totally dependent on import. And this also brings home something which is very important. How self-sufficient must we become, at least in our food stocks, in our food supplies? And this is something that people now increasingly realizing that they need to go back to agriculture again. They need to go back to subsistence farming. If each one of us might have a small garden and at least get some of the basics food stuff there. Then in terms of how the economy is so dependent on everything else which is going on in the world, closing down our borders, going into isolation, right? The lockdown, as we see it, is going to have a huge impact on the economy as we will come out of it. Closing down the airspace has meant that tourism is almost dead, right? It will be so until, I think, beginning of 2021. So for one whole year, we have wiped out 23% of our GDP. 9 points come directly from tourism. And now if we add to it all the aggregate, we will reach almost 23% that's gone. So we can imagine the economy contracting by at least 10%. And that's a huge, huge blow to the economy. As previous speakers have said, not getting the remittance as well, because many people actually work overseas and they send money to Mauritius, to families. So this, of course, will be reduced, although, you know, in terms of the economics, I don't know to what extent, I don't have the exact figures, so I better not put any figures. But I know, for example, islands just next door to us in the Comoros, for example, the input of remittance is very, very big in the local economy. So this is something that's going to actually touch a lot of us in terms of this issue. Food security will be an issue because of the border exchanges don't happen very, very quickly. And it will also affect all the important the staples that we are used to. But fortunately, we've had some reserve, and there has been planning in such that, you know, we will not be impacted too much. But having said this, as we are moving in 7 weeks into the confinement, we will increasingly have, for example, to fly medicine, for example, essential medicine, and that will increase the cost in a big way. So people will be impacted directly. And one thing that we also must bear in mind is that the banking sector is looking at you know, the entire economy and how this will impact the local currency as well, because how the fluctuation will be too big. And I know the rates, the bank rates, and all that goes with all the banking sector will have to be really looked into. So whatever happens with the bank, whatever happens to the currency, will impact our import, will impact the export as well, but more import, because we depend a lot on import. So all these will have a big impact on our economy, and also will bring us to think as well, to what extent do we, for example, in terms of food security, how much will we have to start growing again locally? Because we have gone into this comfort zone of saying we can import everything. But right now, there is a rethink as to how much we can import, how much we should import, and how much we need to produce locally. Now, the spin-off from this is that when you start thinking along these lines, you start developing a new pillar. And this new pillar will be through entrepreneurship. This new pillar will be creating new jobs. This new pillar will be to leverage technology into, for example, generating food. So all these aspects of COVID may not be all negative. I think it's going to bring people to think differently, to think laterally, how to actually make the people go back to the soil, how to make the people do things differently, and of course create jobs at the same time. So this is, to me, the silver lining that I can see with COVID, at least in terms of our rethink, so that you know, we start thinking differently to actually address the issue of unemployment, because I know in some parts of the world it's already hitting the economy very, very badly. So we will have to grapple with this, although we are a small economy, but nonetheless we still have to provide jobs for the youth. So to make the youth be more informed, so this is something that we will have to come across. And one thing that we have also noticed, Theo, is that right now, entrepreneur, be it young people, be those who are, they don't need lecturing. They just need to be kind of mentored. They need to be given ideas. They need to be kind of given guidance of how to leverage these challenges into opportunities. And I think there is a big role of mentoring that needs to be done as well to get the economy up and running, even before the lockdown lifts up in many parts of the world. So these are things that we have to rethink, just go think beyond the direct impact of import, food security, and all the rest of it. How we can leverage all the challenges that we have to start the economy running again, but using different tools, because the normal we were used to before the lockdown is no longer applicable when you open the economy again.
Thank you very much. I mean, it's a detailed picture you provide, and very clearly as well, if I may say, Ameenah. So thank you very much in terms of thinking about the impact of tourism. Before I bring it over to you, Borja, because that also affects Spain, I believe, as one of the major tourism-based nations. And But picking up a little bit of what you said, I mean, I think it was very interesting to learn of the need to rethink how we're going forward. And I think that's a very positive message, and to be proactive and also not to instruct people, to listen to them, to give them the information. I think, thank you very much. Borja, I'm going to bring a question to you from France. It's from a nurse in France, Janine Campbell, and she has spoken from a French perspective, and this is an interesting point, but the French President Macron talked about allowing for some flexibility on third world debt. How far has this progressed to be realized? Over to you, Borja. You're just on mute, Borja. Thank you.
Yep. Thank you, Theo. Definitely, I was saying that tourism will have, among many different countries, definitely Spain will be one of the most impacted. We receive more than 18 million tourists every year. And one of the things that, not only because it's an important industry for the GDP and for many citizens, many people, Spain has the highest percentage of temporary workers compared to fixed contract workers in the European Union, or one of the highest. And the reason why is because we have this flexibility in the contracts, because there is a lot of people working in tourism and in the service sector, right? So suddenly all those people are suddenly unemployed, definitely, for the impact in tourism and on other services. And there is a huge impact on the fiscal space that we need for the safety networks that these people might need, right? Regarding the question of France, I mean, as far as I know, I think the G20 approved to suspend temporarily the payment of the debt to the low-income countries until the end of the year of 2020. So this is something that all the finance ministers and central banks of the G20 were meeting in the middle of April, and I think they agreed to postpone that. That's one thing that actually I think is quite good. And another thing will be this is the public market of debt and loans, etc. But what's going to happen as well with the private one, right? Because at some point there should be a collaboration, in order not to create asymmetries between payments, free riding versus the payment between the private loans, public loans, right? So this is something that should be coordinated. But as far as I know, they approved this until the end of 2020.
Thank you very much for that input, and to help us understand what's going on with both in Spain from a tourism perspective, but also in terms of what the G20 are doing to act. I suppose a question that leads on from that is whether it's enough, but possibly one that we're going to have to explore in the future. Velislava, can I bring a question to you, which is also related, and it's interesting. It follows on well in that sense. It's from Gianluca Tomasello. I believe he's based in Spain, and he has asked, how do you think the international aid sector should and could move to support humanitarian action against COVID-19?
Well,
over to you.
There's multiple ways, and depending on the mandate of the different agencies, they've done their share of work and in focused efforts. But I think it's an opportunity to, and I think we mentioned earlier, to think of a lateral approach and to think of a cross-sectoral way of doing things. And it's more about really that need to strengthen capacity and to build systems that are in place there. They could be logistics system, they could be primary healthcare system, they could be energy solutions, there could be mobile and digital solutions that need to come from different sectors, and ultimately health spreads through many areas of life, and there has to be such an approach to providing health in the future if we are to be better prepared. I think it has to, as a role of advocacy from one point of view, of really putting forward the idea that we need to, there is actually to some extent there is an ongoing conversation of will development budgets be affected by COVID, whether donor countries, the traditional donor countries, would be then not so disincentivized in a way to invest in development aid because they will have internal pressures to support their own economies. And I think we should not fall in that trap, and international organizations should try to really play that role of uniting efforts to show clear ways forward where we really need to shift away from just providing aid to investing, because investment is the way where you see the longer term potential grown for Africa and other countries in the global south. And that's where, in a way, that you invest in a future that is a lot beyond health and in many other sectors. And I think the international organization need to play that role to and to provide the right mechanisms that both donors or in the public sector as well as private sector money gets channeled in the right way to provide this economic empowerment in a longer term investment and growth that will be needed to protect us in the future. I don't think that the siloed approach to health will help us to be better prepared in the future, even if we bring the best technologies forward. And I think we need to play that role of uniting efforts and providing the right systems to be in a concrete way for aid to be developed in the future in a bit of more investment framework.
Thank you very much, Velislava. If I may just follow up one point, because I think it's very interesting that you bring in, one, the need for preparedness, which I think is an imperative that we have, but also touching on your last point in terms of how it's been said recently that possibly this crisis has been over-medicalized. Is that something that you would agree with, or do you have an observation on that point, and that we need to broaden the discussion even further?
I think health is just put at the center because health has been disregarded for a long time, and that's why it seems unusual. Health in itself crosses multiple sectors of society, but over-medicalized, perhaps that's a part of a rhetoric that we've discussed a lot in the AIDS response about how we consider only the disease as it is disease, but actually it exposes internal inequalities and poverty on lack of access to healthcare. And I think over-medicalized is part of this siloed approach to health that I said, that it should not happen. I think the over-medicalized effort is just because that's the lower hanging fruit and probably the most immediately needed response that has to happen. The vaccine being this vaccine race at the moment, and really that incentive to create a vaccine as a way to step away from a massive lockdown is what puts the health and the medical approach at the center. But of course, there's a lot of ongoing and underlying processes that are happening. It's probably the publicity is focused there because it seems the most obvious and the most really needed first step. But a lot of the consequence of the COVID epidemic that would be seen in other sectors will bring the conversation forward there, but we should not really wait for that to happen, because a lot of it, what we've seen in the past, is the minute there is a vaccine for a certain disease, we forget that health is important. And that should not be that same trap that we fall in, because the urgency of the situation is the exposure of the vulnerabilities of other sectors, is not just the lack of a vaccine. And I think that's a key differentiation to make.
Thank you, very helpful, and important to think about that more holistic approach that's needed to address this situation, and more broadly to do so. I want to, and a connected question here from Michael Baser, who's a public health student based at King's College London. It's a question, if I could ask you, Ameenah, what is the most important thing for government policy decision makers and community leaders to do during the crisis? Over to you.
It's a very, very broad question. Well, I think governments, they have to run the country, they have to keep people safe, and they have to actually enact the law. For example, during the lockdown, they have to make sure that people listen to all the advice being given. If people don't listen to the advice, and they have to take the appropriate measures that they have to make sure that people, for example, stay. It has been very difficult, I know, to change the habit of people, to make them stay inside, and how we have seen all sorts of associated downside to maintaining people in their homes. And in some countries like France, for example, they've had to actually resort to getting hotels to prevent domestic violence so that the wives and the husbands can be separated. All these things, all these governments have had to do to grapple with this new virus which has created havoc right across the world. So governments, they have the duty to govern and to actually impose and to make sure that the law is adhered to and whatever advice they're giving. But I think we have increasingly been talking about the state of preparedness. And I think this has, the COVID has revealed the state of lack of preparedness of many of our institutions, especially the public health sector. And in some countries in Africa, the public, the basic public health sectors in many countries, which of course has never been taken seriously. And right now, there's a lot of talk about getting the vaccines, and I think we've heard a lot of discussion, a lot of conversation going on within the WHO. They are not very optimistic about getting the vaccine for at least another 1.5 to 2 years. So what do we do in the meantime? And the thing is that one also must bear in mind that COVID is a virus. And we mustn't forget that 30 years after the attack by HIV, we're not there with the vaccine so far. A lot of money, a lot of work has gone into malaria, for example, to develop the vaccine. We're still not there. So yes, a vaccine eventually, but one also must bear in mind that the flu vaccine is available. Some people choose not to take it. Some people say it doesn't provide you the entire protection, which is also true. So I think in the meantime, while the researchers are going on looking for that vaccine, we must try other medication which are available. And this evening I heard about remdesivir, which is going very, very fast in terms of testing. So we have to do all this, but I think the public health space has to be looked into so that at least we can do more prevention. And one thing they have seen, for example, during the Ebola crisis is that if only they taught people how to wash their hands properly, provide soap and water, that would have been instrumental in bringing down the number of deaths. So same thing happening with the COVID. How do we prevent people getting infected? How do we reduce, for example, the transmission between person to person, the community transmission? So all this have to be explored side by side. And of course, in parallel, we go for the medication, we go for the vaccines, we go whatever the science is going to provide us in terms of means to tackle this disease. But we have to come to terms with the fact that for the next 1.5 to 2 years, we are going to be here with this pandemic. How we reduce it, how we relaunch the economy, and how we stop, we actually get everything back in the perspective again, will all depend on the measures we take now. And I think right now everybody is pointing out to prevention. So let us operate in that space. Let us also try medication. I know the researchers are very busy trying out all the medication, all the various combination to see how we can bring a halt to the transmission, get the economy running, and in parallel, start with vaccines, start with other high-tech medical devices that we can bring so as to contain this pandemic. But having said this, this is one of more pandemics to come. So the more we take our health space very seriously, the better we're going to be in the light of climate change, in the light of other pandemics that will come our way, so we can show our preparedness to this.
Thank you very much, Ameenah. That was well put, and it's an important point to acknowledge there in terms of the complexity. And I think one of the added parts to that question, and maybe if I could just ask you to look into or to explore, is the role of community leaders in that scenario. I mean, there's a lot of talk about what government action is. There's also a discussion ongoing that it's brought people together, and it is going to bring communities together. And as you say, if it's going to be ongoing for a year or two, how and what role do communities play and community leaders there? May I ask?
We have here in Mauritius a good example of how we kept malaria at bay. We are certified by the WHO to be malaria free. because we are a small place, we can do the monitoring right from when the person lands at the airport and all the way for the next 15 days they are monitored, so that we can reapply for the certification to be malaria free. So for us, we already have the infrastructure put in place there. We have all the people who are trained in the public health space. We have the authorities who are very well aware. So I think we have to deploy this kind of infrastructure at the community level so that people are forever being informed. And as we are saying that right now we're getting an overdose, a lot of noise going around. So we have to translate all that information into very, very short, brief sound bites that people can actually digest and make sense of it. So this kind of level of communication has to be brought down to a level that people can understand and people can relate to, because this is something that we have seen a gap in terms of that transmission of that knowledge. People still were not aware as to why they have to stay indoors. Up until you don't explain it to them, you don't demystify the science in such a way that the narrative is understood by one and all, we will not be making a big dent into this campaign. So we have to keep on communicating. We have to keep on apprising the community leaders so that they in turn can transmit that knowledge in language which is digested, which is understood by the common people. We will have to not kind of compromise the quality of the science, but put it in such a way that they can understand, and then you'll get the cooperation, because up until the time people don't understand, they will not cooperate. But at the same time, there is something in parallel that we have to put in place, and these are where the leaders come in, is to ensure that these people are having their food, they are having the water, they are having the energy, they are having the IT, because can you imagine if this pandemic had happened 10 years ago when we did not have WhatsApp, we didn't have technology, we didn't have Zoom? I mean, we would have been in a worse scenario that we are right now. So we have to put all this perspective so people will cooperate when the dailies is not too impacted. And this is again something where IT, I think, is playing a very big role, and we are seeing increasingly, at least in Mauritius, online delivery coming into place, digital way of teaching people, kids at home. So all these are coming into the fold nicely. So communicate, but also make sure that the livelihoods of these people are not too impacted. It's only then that we will get the full cooperation.
Thank you very much, Ameenah. An important point there, and I think in particular in regards to communication being so key and putting it in a translatable and understandable language, so it's not, as you say, one and all and assumed that we know. I think that's such a crucial point, especially when you extend it into climate issues as well.
Yeah, and one thing as well is that we have to be as candid as possible so that we can get the trust of the people. They have to be communicated in a language so that they can trust, in data that they can relate to. And this is where the trust of the community has to be gained up front in this battle, because if you start providing information which they don't believe what is happening on the ground, and also the gossip, because a lot of fake information is going around. So leaders who are communicative have to be there to communicate properly, to communicate the right information, and to give the right data and the right advice. Because this is very, very key in a time of the pandemic for people to keep trusting institutions.
Yeah. Thank you very much for bringing us around, and that's much valued. I'm going to travel now to Sadiq Mohammed, who I believe is based in Abuja, and he has a question, and I'm going to bring this to you, Borja. The question is, how can the developed countries support the developing countries, considering the world is now a global village? The nature of COVID-19 is such that the spread could continue if there is no platform on the world stage to have agreed measures moving forward, such as travel and tourism. May I ask you to provide your perspective on that, Borja?
Thank you very much, Theo. Yeah, I think, I mean, the multilateral cooperation where somehow developed countries have been coordinating official development aid or other mechanisms, have been in risk recently, right? We see that institutions like the UN, for example, well, the US is not anymore like leading or supporting, or is renouncing to lead it as it was before. It had a lot of complications to solve the Syrian war. The Paris Agreement for Climate, for example, is hard to convince different countries, and even though it was partially successful, still there is a lot of things to do. We have had a lot of conflicts with trade, right, recently, and with the World Trade Organization. So now we are so far facing a huge opportunity to either to strengthen the multilateral cooperation, or in contrast, to fall down in the crisis that was entering before, right? So multilateralism in this sense it will be quite important. Then I think there are different mechanisms, right? Like, so the UN has already established a UN crisis management group. The World Health Organization has established a strategic preparedness and response fund, and through that fund, they are responding and buying a lot of healthcare materials that will be needed to face COVID-19. And many of the developed countries are putting money in these funds, right? And as well, the UN, for example, has established a strategy and 5 different pillars where developed countries should support. So these 5 pillars are the following. First one is health, obviously protecting health services during the crisis. And here there is an interesting fact, because I was speaking with the director of the health unit of the Spanish Development Office, and she was explaining me interesting insights that usually for health, the traditional development has been focused on primary healthcare, right, on basic healthcare, and we have to recognize that in low-income countries in the last decades there is already a strong network, for example, of health community workers in order to stop the impact of different diseases, right, in this case. And on the other side as well, you have philanthropic foundations like the Bill Gates Foundation and others who have been creating big health funds, but focus on niches, right, on let's finish malaria, let's finish HIV, without having in mind a comprehensive structure of the national healthcare system, right? Therefore, at the end, the development mechanism have forgotten to invest in advanced services, for example, in advanced medical health care management services. Because if you want to manage a ventilator, for example, to treat COVID-19, you need to have intensive care, right? And you need to have human capital who know how to manage themselves in an intensive care unit at the hospital. So those advanced services have not been receive so much investment, right, in terms of health. So that should be a change that maybe in the future should vary. The second pillar is protecting people. And here the social protection safety net networks will be very important, especially to cover, to increase the food supply and the access to food. As we said, that would be one of the risks for those ones who need income or who are in extreme poverty, or as well basic services like education, right? So those ones will be very important to support. The third one is economic response and recovery. And here we can, we have points like informality, how we can support informal sector workers, right? As we said before, is very important because they do not have insurance, they don't have the safety net, sometimes they are unknown, and how you can protect small and medium-sized enterprises, right? To protect jobs and to keep the economy ongoing. The fourth one, which requires multilateral collaboration, is the macroeconomic response. And here for example, remittances. So in remittances, there are some things that can be done. One is to reduce the cost of remittances. So I was reading some data before this talk, and I realized that, for example, in average, the cost of remittances is between 6 and 8% of the amount in some countries, in low-income countries in Africa. That means that is a huge cost, actually, that you are paying. The transaction cost of that remittance is high, right? So during this crisis, something that developed countries can do is to reduce that cost, or the transaction cost of the remittances. And as well, something that will have a huge impact is that I mean, look at Trump and in the US, how much they are pushing and putting some stigma on migrant workers, right? On migrant workers. But those ones are very important to protect, because if you protect their livelihood, their jobs, their income, then the remittances will increase as well. So it looks like, I mean, everything is somehow sometimes interconnected. The same thing with capital flows. So advanced economies and developed countries should stop the retirement of those capital flows from emerging and low-income countries, because you are pulling away the capital from those. So it doesn't have any sense to say, yeah, we are investing some grants on aid, right? But at the same time, you are not controlling those capital flows. You are not controlling the transaction cost of remittances. You are taking advantage of all the financial market that you have availability for them, because obviously you have more transparent, you have better governance, so the market will trust more on you, right? So that will be very important. And finally, the social cohesion and community resilience. And these are some points that Ameenah was referring. How important as well is to support community leaders. And something very interesting, if you analyze, for example, how every country is doing the reopening phase, right? And what are the criteria and the rules established by the society. And you would say, well, maybe it will be easy to take a recipe on some countries that this has worked and then apply to the other one. But you realize that each country is completely different and is applying completely different domestic policies. And the reality is that sometimes the community, the structure of the community, how they organize, they have their own mechanism. So they have their own mechanisms, and they should define themselves how they are gonna deconfine and how they are going out to the streets, how they go and use the public services, how they are gonna go to shopping, etc., etc. This is something that the communities themselves should define. And the social cohesion is very important, not to leave anyone behind. And with this, I finish. So these crises affect differently children, elders, people with specific diseases. So there are different groups, and all of them should be somehow considered in a potential response.
Thank you very much. Well, I like that you finished on community cohesion there as well. And you also drew on another point that's come up in a question from Iman Hamid, who I believe is based in Singapore. And she's asked a question, she's actually asked several questions, and I wonder whether you could address a few of them, Velislava. I'll try and put them together, but how can we change our education systems, especially in the global south, to enable our research capabilities? But also something here that's key is considering there's been a lot of conversation about structural reconfiguration, and the world is run through productivity and economic profit. Key point here, maybe related, is urbanization, even during the Ebola crisis, has played a huge role in transmission escalated. Going forward, should the world rethink how life can be removed from concentrated urban areas? I suppose combining that area aspect of education and how we do it as a research capabilities. May I pass it over to you, Velislava?
Sure. I mean, I'll try to, two sides of a question. I'll try to answer them quickly. First, around changing education, we need to, and I saw there's a related question that I'll try to incorporate as well. We need to re-evaluate how we evaluate research and research outputs and education outputs. Is it research papers? Is it impact to society? And re-evaluate what's the role of education in its relationship with society and the impact it has there. Currently, impact to society is set at the background, and it's more about research publication. That's why we see a shift to this now, because currently research has to, and research that's been ongoing, has to come at the forefront and provide the new candid vaccines or new therapeutics, and that's where the real need of research and education is put at the forefront. And I think from that perspective, we need to assess the relevance of research and how we invest in it a lot more from this framework, and really think and encourage the next generation to think of its role to society as such a provider of knowledge and to driving that innovation there forward. In terms of changes in education, we saw that we could do education remotely. And another thing I mentioned, education is tightly related to the human resource that we have in order to tackle such an epidemic, but also to tackle other kind of societal challenges that that we might face in the future, whether they're infectious disease or something else. And we see innovation there where, as I mentioned, there are blended models that use the IT infrastructure, they use the human resource in other countries in order to provide teaching for others where might not have the facilities locally to do that. And I think we'll be seeing a lot more of this distance learning from the same way we've been seeing telemedicine as put at the forefront of how it would be possible to answer some of those diagnostic challenges. I think education will have to take such an approach as well. So I think the two main ways in which we'll see changes is first the way it's delivered, whether it's delivered always through a physical means of someone teaching you, or can be done remotely. And this would actually provide access to people a lot more than we were able to do before, and will remove some of the barriers of lacking local educators to provide education. But B, I think it will change. We'll have to reformulate its role as impact for society, and that's how we would need to see it. That's how we need to deliver it. As I said, researcher and academic I've been for probably 10 years or so. And it wasn't until I went to Africa, and it wasn't until I tried to implement a solution I've developed in a country where I thought it would be best fitted, that I realized that it's not going to work, because it was this siloed view of it that sometimes research or only one sectoral approach to it provides. And I think education would have to really come at the forefront of this Sustainable Development Goals agenda, this research agenda, but we need to work a lot more with countries in the Global South to understand what the real needs are, to understand what the real gaps are in order for us to provide solutions through education and research. And on the second point about urbanization, I think the aspect of how education can be reformed through providing these opportunities for distance learning and for blended model would, to an extent, be able to be a path to solve that need for urbanization and for everyone to go to the big cities to find places to study or to work. In a way, if we manage to learn the lessons of that we don't need to be all at the same place to be working together, and in the same time, the fact that we are different places doesn't mean that we might not be facing the same challenges. I think these two lessons that COVID is teaching us now can really be incorporated in trying to find new ways of which we work and study. But we would need the system and the institution that adopt that new framework, a new way of thinking. I think where the barriers might be a bit more, are we able to put the systems in place? Are our governments and educational institutions able to support this? But we definitely have the incentive now to do it. And I think these will be the areas in which we'll have a bit more equal access to education, and then really better distribution of human resource to be better prepared in the future, but also make use of that technology that's coming in every sector, really to apply to areas where the output could be with a very tangible improvement of and access of society to a better science, better healthcare, better technology for others as well.
Thank you very much. I think it's wonderful to see such a holistic discussion going on and very constructive. Ameenah, you may well have points you want to pick up in terms of what others have said as well, but there is a question which I'd like to direct to you from Tom Corsellas. I believe he's actually based in Geneva, working from the humanitarian sector. He's addressed a number of questions in regards to the World Health Organization, but there is a few that you, as speaking from an experienced diplomatic side, may have an input on. And one of them is, how can we stop ourselves seeing ourselves as the competition nationally or by mandate?
Sorry, I didn't quite get the question.
Sure. The question was, how can we, so I'll give you a bit of a prelude because it's a long question. So the World Health Organization appears to have been told hands off at a national level. How will we be able to build daily innovation around a £8.7 billion budget that's been coordinated? And the question here is, how can we stop ourselves seeing ourselves as the competition, nationally or by mandate? So to promote that cooperative approach, I believe.
You know, as we have said earlier on in the conversation, there's a lot of conversation going on, good conversation, sometimes fake, and some of our speakers because we also know that there's a lot of controversial documents which are going around around many organizations, many foundations, and also, unfortunately, impacting the WHO as well. So far, I personally feel that the WHO has done a great job in terms of proceeding, in terms of warning. In fact, the warning hasn't started this year. They had started a very long time ago. In fact, I even saw Margaret Chan, the previous director of WHO, highlighting the necessity of preparedness to confront pandemics. So it's not as if this institution has not done its job properly. They have been consistent in terms of addressing this. The next issue, I don't know whether I'm going off course, but you tell me if I am, is the WHO is an institution which is voluntary contribution by states, and some countries contribute more, some countries contribute less, and recently we have seen, for example, the United States pulling its contribution from the WHO. How this will impact its work definitely will have an impact, just like when the US pulled out its contribution from UNESCO, we had a big impact in terms of the deliverables of that organization. Is a vacuum possible? No, because we have seen, for example, the Chinese coming in and stepping up the contribution to WHO. And I think just like the UN Secretary Council, will need to have representation. We'll need to have contribution coming from countries who actually believe in the work that WHO is doing, and they need to come in with the funds, they need to come in with membership representing the region, the countries, and whatever it is, the continent on the board, and then they can proceed with the ideals that WHO has been put there to address, which is global health. Now, having said this, in terms of the mandate, they have been very forward into addressing malaria, into addressing these pandemics. Okay, that's all been very good, but I want to come back again to the continent of Africa. There are issues with malaria, yes. There are issues, there have been issues with HIV, yes. But what about the neglected diseases which Africans are systematically confronted with on a daily basis? Who does that? Who actually is going to put money there? Is the market too small for these diseases to be tackled by big companies operating internationally? I mean, to me, these are questions that need to be addressed. And this is where the budget of the WHO maybe is not enough. This is, again, we come back to the region, we come back to the countries where these diseases are very present. And this is a conversation that we need to be having at the level of the African Union Commission, at the level of the regions, because these will call for very African solutions, because no one will look at it.
Picking up from there as well, if I may ask you just to explore a little further in terms of looking at other UN agencies, because there is a lot of focus on the World Health Organization at the moment. There is also the shelter cluster, there's the humanitarian sector itself, which speaks more broadly and has to do a lot of work in Africa and has done so. But in terms of thinking about their roles, do you believe that there's a more cohesive structure to be developed through that? Is again another question from Tom, but in terms of looking at UNHCR and looking at the role of refugees, UNIOM, looking at internally displaced people, and how those mandates are structured themselves. If I could ask you to comment on that in terms of that holistic aspect, Ameenah.
So again, in terms of holistic aspect, there are many such organizations at the level of the UN, and it needs to be reshaped, because I can see overlap between, for example, what UNICEF is doing, and that overlaps with the UNHCR. The work of UNICEF, there may be overlapping issues with WHO, for example, and the World Food Programme, because if we don't want silos, we'll have to relook at all these organizations, because there are many overlaps. Whomsoever is looking at food issues necessarily will impact the health of that child or that person, and all the rest of it. So definitely there will have to be at some point, there is a lot of discussion again at international level between countries. And since the UN had been created immediately after the Second World War, the world has changed tremendously. The world has changed tremendously. And just to put these things very, very bluntly, 70% of the UN Security Council agenda is about African issues, and there's not a representative of Africa on the UN Security Council. So these are questions which are increasingly coming across in multilateral fora, where people are questioning the way the whole governance structure at these institutions, the way they're performing. And there, in some places, in some quarters, there is a lot of nervousness to actually relook at these structures. In some cases, the countries, the regions, they're very forceful to say that, look, the world has changed since 1949, and we need to relook at this because we want our place at the table. And at the same time, if these institutions, these countries are going to lead, going to put money, they will want more results, they will want to see more data, more results on the ground, and they will also like to see less overlap and much more focused actions where they will be cross-cutting. We will not be going into this silo attitude for example, World Food Programme, WHO, UNICEF, and this, that, and the other, UNHCR, all these operating in silos, and yet the problems are the same. We are going towards the security and the safety and the health of the person. So all these organizations, they really need to relook at the agenda and refocus and reassess the way we have been doing so that countries and regions and institutions putting money into this organization, they also get value for money in terms of output and results.
Thank you very much, Ameenah. Much appreciated. We are coming to the end. We have 5 minutes left, so I'm going to ask all the panelists to offer their concluding remarks before we close the evening. But thank you all for coming together, and it's been wonderful. And Borja, I'm going to hand it over to you to offer your concluding remark. Thank you very much.
Well, thank you very much, Theo, for organizing, and on Cov360 for organizing these panels. Well, I think I would finish in the same way I started, to round the circle with the sentence of the Prime Minister of Ethiopia, Abiy Ahmed: only a global victory can end this pandemic, right? So I understand that most of the countries have been focused on domestic issues, domestic problems, because I mean, all of us, we are highly affected. But the final victory will only come when all of us, we end the pandemic. So therefore we are forced to strengthen our international and global collaboration. And that might mean redefine the current platforms. I mean, this year UN was celebrating the 75th anniversary, right? So maybe it's also a good moment to see how we can improve all those international mechanisms. There are already many proposals. Not only in terms of platforms, there are problems that we have in common, like the macroeconomic issues that we have been mentioning during the talk. And we should never forget that even though in advanced economies, definitely we have an impact, when we talk about the impact that this crisis is having in low-income countries, we're talking about people who are suffering acute malnutrition, people who are living with a deprivation of resources that they do not allow them even to have basic services, basic income, basic food. So we should never forget that.
Thank you very much, Borja, for your concluding remark. Velislava, can I pass it over to you, please?
Sure, I would just try to reflect on the point of the last two interventions. One about really, it's an opportunity for us to learn from the past, and the lesson that we learn now will really define how able we are to respond in the future, because it's not the first time we see such an epidemic, and definitely what we discussed now about the need of unity and lack of overlap and more cross-sectoral approach is what drove the HIV response. That's why there was UNAIDS. That's why there was a secretariat of 11 UN agencies, because that was the need then. But the minute there's that lack of urgency of a situation, people's incentive to act together seems to disappear. And we should not repeat this again. And I think we need to use that as an opportunity to understand that the solutions need to be a lot more longer term. We need to work a lot more across sectors. And we also need to understand that in the context of infectious diseases, the health of every single individual is a global issue, because the disease can spread through anyone as a start. And I think there it becomes a lot more the lack of access to healthcare, the lack of capacity of a small group of individuals can quickly become a global issue. And that's why we need to really think of global solutions that are not only seen and implemented when we see a concrete pressure of an epidemic, but can happen in a continuous manner between any other epidemics. I liked or disliked also and hope it's not true, but there was a statement by President Kagame of Rwanda saying that we'll take a generation to overcome the consequence of COVID in Africa. And I really hope that we are better prepared than that. I really hope that we don't need to have an entire generation passing in order for us to see change happening. And I think this would only happen if we pay attention to what's happening now and really trying to mobilize all of our resources and systems, and probably restructure them as well in a way that we are better prepared in the future.
Thank you very much. An important message about our future. And Ameenah, I'm going to leave you for the final note to provide your concluding remark.
I think, as I said, again, to come back to the previous part of our conversation, is that the COVID has revealed our lack of preparedness in many instances. But I still think that there will be a silver lining from the COVID, in as much as it will teach us to do things differently. We will find that there will be an increasing use of technology from now on. So I think to us scientists and to us technologists, it's a very good thing. But I think to the common people as well, they'll know that it's possible to do things differently and to pollute less, and to do things so that we look at solidarity as being the way forward. And we have seen that already during the COVID, that people tend to be less selfish. And I think if we start thinking like this, we will be saving ourselves on the planet, because I hate to say we are saving the planet, because we're not. We'll be saving ourselves on this planet. So let us go ahead with new technology, with more solidarity, and also with a lot of empathy and compassion towards each other. So I think this is what, to me, what the COVID has shown us over the past few weeks.
Thank you very much for that final note. Wonderful evening. Thank you really to all our panelists. I mean, you've covered such a wide array of subjects. We've gone from preparedness and very much focused there in learning our lessons, food and taking a holistic approach and seeing these networks and cross-sectoral aspects of our response and needs to prepare that go beyond borders. So thank you so much. Your Excellency, Ameenah, thank you very much for your contributions this evening. And thank you, Borja, Adjunct Professor at IE University, thank you very much. And Velislava Petrova, thank you so much for all of your contributions and that emphasis on education that is so needed today. And I just want to give a final note as well. I mean, a lot has been commented on my involvement, but this is very much a volunteer movement, and it is very much we. None of this is possible without all of the volunteers around the globe supporting Cov360, collaborating together and building this community. So please do explore our website and do get engaged. And finally, thank you all to the viewers for engaging in a wonderful evening. Thank you very much, and I'm wishing you all a good night and good day.
Thank you so much. Bye-bye.
Thank you for your dedication, Theo, and the team.
Thank you.
Bye.